Good afternoon. My name is Dr. Carlos Perez. Welcome you to Nova Southeastern University. We've got a presentation, Save Your Mindset, beginning in just a few seconds. For that, I want to introduce our students. Lori, you want to introduce yourself?
Hi, everybody. My name is Lori, and I'm currently a neuroscience major here at NSU, Florida, in my last year.
Excellent. Congratulations. Morgan.
Hi everyone, my name is Morgan Kath and I'm a fourth year within the clinical PsyD program here at NSU. And then I also have the pleasure of working within the Office of Recruitment and Admissions. So pleasure to be here and it looks like it's going to be a very interesting talk today.
Great. And Lori, you want to go ahead and introduce our guest speaker?
Of course. Welcome, everybody, and thank you for joining us today. Our webinar is titled The Savior Mindset in High Stress Jobs Lessons Learned from Working with First Responders and Government Agencies. We're pleased to welcome Dr. Myron J. Burns, Associate Professor in the Department of Psychology and Neuroscience at Nova Southeastern University's College of Psychology. Dr. Burns teaches across psychology, counseling, and substance abuse studies and brings extensive applied experience working with individuals, families, first responders, military personnel, and government agencies operating in high stress environments. His work focuses on stress management, depression, substance abuse, and resilience, particularly the psychological cost and unintended consequences of the savior role in helping professionals. Today, Dr. Burns will explore how the savior mindset develops, why it is reinforced in high stakes roles, and how professionals can maintain effectiveness without sacrificing boundaries, well being, or long term sustainability. Dr. Burns, thank you for being with us, and we're looking forward to the discussion.
Thank you. And good afternoon to everyone who's logged in. So I want to go over the outline of what I'm going to cover today with you all regarding the what I labeled as the savior mindset. And give me a second here when I get my screen. All right, thank you. Got it there. So as far as the talk and how this talk will go, I'm going to give you a little bit of background information on how I got involved in the field and working with these populations. I'll also have to give a disclaimer, and along with my disclaimer, I will discuss some of the terminology and why I chose to use certain terms. From there, we'll move into the culture and the personality traits and characteristics that I've seen across these different populations. We'll also discuss what stress looks like on the job, some of the physical and mental results from working in these high stress, high risk occupations. Towards the end of my talk, I'll move into some of the work home life examples that I have seen, as well as what has been reported to me in my work with these groups. We'll then identify some warning signs of burnout. And then finally, I'll discuss some protector factors and recommended strategies. These recommended strategies and protector factors will come from some of my direct work, as well as focus groups on what these populations have indicated to me that tends to work best for them. All right, so let me move into sort of my bio and background. So the group did a good job of introducing who I am and some of my background and training, as far as at least where I'm currently working as being an associate professor in the Department of Psychology, as well as teaching across the Department of Counseling. My graduate and clinical training was a unique experience because I'm trained in applications of counseling psychology from an academic side. But my graduate program was rather unique because a large percentage of the faculty also had a clinical psychology background. So I was able to incorporate elements of counseling psychology along with receiving a lot of training in clinical psych applications. And that kind of led me to my work with law enforcement. So very early on, I had a professor and a mentor who was the head psychologist for the Nashville Police Department. And I worked directly with her in the behavioral health division. I had really no interest or desire initially in working with law enforcement, but she said this might be a good experience for you, and it may come out to be helpful later. And she was absolutely correct and right in that regard. And I'm happy that she kind of led me along that route. So along with some of my initial clinical training with her, it led me to one of my first employment opportunities where I was trained in doing clinical stress incidents debriefings. I can tell you back then that the officers did not like that process. I can also report today that I hear that many still do not like to participate in that process. I also worked with family support divisions. So reintegrating a lot of what the officers were doing when it comes to work-home life balance and providing that bridge when it came to family support with the high stress that the officers deal with while incorporating with their home life. And I'm going to talk about that later when we go over some of the strategies. Now, from that experience, that led me later into working with the military population. So whenever I talk about the military population and my interests, I share some interesting side bits about myself. So when I wake up in the morning, my sheets on the bed have to be made so tight that you can flip a coin off of them. A lot of my coworkers and colleagues will tell you that my desk is very organized. They sometimes think that I'm strange. I do have some of these attention to detail, obsessive types of tendencies where everything has to be in a certain way, in a certain order. Cleaning my bathroom, I clean it actually with a toothbrush to get between the cracks and the grooves from the tile. Immediately, people will think that I was in the military. I was never in the military. However, I had a father who was a drill sergeant. So very early on, I became aware of a lot of those personality traits and characteristics, some of the pros and cons of those characteristics as well. So I'll highlight that. So my work a lot with the military has mainly dealt with psychoeducational types of groups and focus groups, and I'll talk about those experiences as well. So let me start off with my disclaimer. And the disclaimer that I have, the time that we have allocated today, I'm going to be covering about 40 minutes of content. I'm going to make sure I save time for questions at the end. But in this small amount of time, I'm not going to be able to possibly cover every single dynamic when it comes to these different professions and the unique challenges and things that they face and experience. Also, you have to keep in mind across these agencies and organizations that there's a lot of variance and variation. So, you know, when we think about the military, there are differences between the Army, the Navy, the Air Force, and the Marines. So when I talk about these groups and when I work with these groups, I often use the saying that there's no one size that fits all, that many individuals may have different experiences along the way. But what I'm going to do is just kind of highlight some of the commonality that I've seen along my journey working with these populations. Now let's move into the terminology. So one of the things you'll notice from my title is that I use Savior's mindset, and many of you may be familiar with the phrase Savior's complex. And I try to avoid that. And I think a lot of that comes from my training in counseling psychology, where I typically try to focus on the positive aspects of behavior rather than pathology. And it's not to say that this mindset doesn't have its unique challenges, but I try to look more so from a strength perspective. So I'll talk more about that as well. First responders. So first responders comes from my work directly with law enforcement, as well as firefighters and emergency medical technicians. So when I talk about first responders, I'll usually be coming from that perspective. And then finally, government agencies. This could include those branches of the military that I talked about, but then also individuals who may work being a data analyst or in the background. So that's how I'll use that term, government agency. All right, so let's move now into the culture, personality traits, and characteristics. So once again, I'm focusing more so on some of the commonality that I've found across these different professions. And I'm going to start first with survival mode. Let me say this. In order to work in these types of professions, it takes a very special, unique individual to make sacrifices, to be given of oneself, to protect and serve, in many instances, putting one's life on the line. And I think far too often that a lot of times people don't think about some of the unique characteristics and traits that you have to have in order to put your life at risk for others. So that's one thing that we need to keep in mind. Also, when I think about where I mentioned that savior's mindset, I also think about other professions, including my own profession. So anyone in the helping profession, I've seen over the years that oftentimes we are so giving of ourselves that we may neglect our own welfare and our own self-care. So not only from those who may be clinicians, but I've seen individuals in my field who may have a specialty area where they're always giving or trying to serve in that particular area, but sometimes, once again, neglecting one's own well-being. And that is tied to that survival mode or that survival mindset, where individuals in these types of professions are constantly going and going and going, oftentimes to the detriment of our own self-care, almost like those perfectionist types of traits and qualities. Next, we have planned and orderly, where rules and protocols need to be followed. Individuals are bound by these rules. It also requires some flexibility because there may be spontaneous things that happens. So you have the unique challenge of having to work within these rules and protocols while being planned and orderly, but also being very flexible because of spontaneous things which may happen beyond one's control. Third factor is attention to detail. So I oftentimes will use the example of dotting the I's and crossing the T's. And so attention to detail is very important in these types of fields and careers. And when you look at the first three bullet points, oftentimes those who are outside these professions, could also be even some family members and friends, may describe individuals in these professions as being uptight, as being rigid, as being stubborn. And the response that you will get from members of these professions is that they would say, damn right. And that's because lives are at stake. And it could be a matter of life and death in many instances. And so that's why these traits and qualities are important. Another factor that comes up is hypervigilant. So being constantly aware of one's environment, one's surrounding. And I have to say that some of these characteristics, particularly the hypervigilance, is also rubbed off on me in my work over the years, where one example I can think of is when you're going out to eat, I can be sometimes with family members or friends and they may sit anywhere. Whereas when working in these types of populations and being surrounded by individuals from these fields, they're very careful in where they're going to sit. They're going to make sure that they're able to see the exit door or who's coming in and who's coming, going out of various facilities. And so this hypervigilant also requires some delicacy, because we use the analogy in my work, and others have also attested this, turning that light switch off and on. And I've seen some who are very skilled at doing this, and then others may struggle with turning this light switch off and on. But being aware of what's going on around one's environment and setting is also important to the job. And then a final trait that I've often seen across these professions is problem solvers. And so they are required to solve problems or bring resolutions to issues. When you think about these traits and characteristics as a whole, there could be positive aspects when it comes to one's job, but then they could also create a disconnect when it comes to interacting with those who are not a part of these professions, as well as family members and friends. And we'll talk more about that work-home life balance. So there are pros and cons to these traits as well. All right, another characteristic and trait, and I want to see for those who have logged in today, if you can figure out, we refer to this as because there are many dirty four-letter words, but there's a running joke among members of these professions, particularly I've seen it with the first responders, but you can also see it in the other branches of service, that we refer to it as a dirty four-letter word that's often used or avoided in these types of environments or settings. So I just kind of want to throw it out to the audience to see if you all can figure out what word I'm referring to that's oftentimes avoided in these settings. I see feel, close, quit. Ah, there we go. Help. Yes, help it is. So very good. Get a reward for that. See Carlos. But yes, help is oftentimes a word that is avoided. One of the things that I do at the beginning of my session is that I will ask group members, how many of you would be there to help a colleague, help a friend, a family member? And you see all the hands that go up. And then I would ask, well, how many of you, if you were in need, would you ask for help? And that's when the room kind of goes silent, and that's when you don't see the hands. And it goes back to what I've highlighted earlier with that savior's mindset, and it comes along with the helping profession, that oftentimes in these types of populations that, you know, including mine, we are so giving of ourselves that we are reluctant to ask for help when needed. So a lot of my work also deals with trying to overcome this barrier. And it comes from a historical aspect of the culture overall. So when I first started working in this field, and it's almost close to over 20 something years ago on the law enforcement side first, discussing issues of stress and trauma or even family matters were taboo. These superiors were told that you deal with it, you suck it up, it's a part of the job. But doing this and internalizing a lot of these factors and a lot of these stressors that happens on the job can be problematic later on. It can lead to problematic behaviors that I'll also highlight. Now, I can say over the years as a culture, things have gotten better. It's not like it was some 20 something years ago, but still we do have a ways to go in that regard. So I'll also highlight some of those unique experiences along the way. All right, so let's now move into some of the occupational stressors and the tolls that can happen along the way, whether we're discussing first responders or those who are part of the military. So both are involved in the front line of safety, whether that's domestically or abroad, which could include responding to medical emergencies, natural disasters. Even those who serve in the military may be called upon to respond to natural disasters. There could be traumatic accidents. There are shootings. Those who are serving abroad could be sent on combat missions or special assignments. Also along those lines, you have time constraints with little control over one's work schedule. Sometimes your work hours, these hours could be extended, not only hours, days, perhaps even months, depending on the particular setting. When it comes to stress, we all as human, many of my students can tell you that when I talk about stress, I emphasize that we're all going to encounter stress at some point along our lives. And really, unless you're either cremated or 6 feet on the ground, that's usually the time you don't encounter stress, that we do have some type of stress in our life. But when you talk about these particular occupations and settings, exposure, patterns, training, and culture is unique when it comes to stress. Because as I mentioned, we all experience those acute short-term stressors, but in these populations, the stress oftentimes is internalized. And I've heard individuals that I've worked with in these settings will say that I'm built for this. My my mind is built for this. I can deal with this. And that is true to a certain extent, that you can be built, that you can be conditioned to withstand some of the stressors and traumatic experiences that one is exposed to on the job. But I also use the analogy like a vehicle, that a vehicle, whether it's a truck that's designed for off-road terrain, The tires still need maintenance, whether it's a speed car that's designed for racing or maneuvering. Once again, oil change, tires, all that stuff needs to be checked. And the mind and the body is the same, that at some point, without proper maintenance, it's going to break down on you. So while individuals in these settings are designed or conditioned to deal with these high stressful, impactful environments, the stress can lead to chronic stressors long term, particularly when it's internalized. And another analogy or example that I use is kind of sticking our heads in the sand. When we don't process and deal with some of the stressors from the job, it can become cumulative and it can build up over time. So in these types of settings, the stress is more so delayed. And without that proper maintenance and care that I've highlighted, it can lead to some long-term health issues, mentally as well as physically. So some of the research findings from these populations, and here's where I talk about some of the commonality. First responders and military personnel have an increased risk. And when I say an increased risk, this is in comparison to those who have jobs that are much different from these professions. So whether it is military personnel versus those who are in civilian life or civilian world, or first responders in comparison to other nations, there's a higher rate of mortality, a higher incidence of cardiovascular disease, and that can come from some of those stressors that I mentioned about earlier on the previous slide, particularly if those stressors are not addressed and dealt with. There is changes in one's shift and work schedule. So I mentioned those long hours earlier. That can also lead to sleep deprivation, sleep issues, which has also been associated with psychological distress, which includes anxiety and stress related issues. Also, within these populations, when you think about the shift work and the sleep deprivation, high use of caffeine and caffeine intake within these settings. So the long-term chronic stressors, the physical and mental health implications can result in some of these factors I'm going to highlight now. So when we look at first responders, when we look at military personnel in comparison to civilians, in comparison to those who have jobs that are not related to these high-risk, stressful environments, there's more of an increased risk of depression. And depression doesn't look the same for everyone. So depression is not necessarily being sad and in a corner balled up crying. Depression can also manifest with some of these other issues that I've had highlighted in bullet points, as well as anger and irritability. PTSD. So earlier I mentioned the dirty four-letter word that's oftentimes avoided. Now I'm going to focus on an acronym that sometimes is avoided or doesn't like to be looked at or focused on, and that's post-traumatic stress disorder. And what I've noticed over the years in my experience is sometimes there is misconfusion and perceptions regarding PTSD. So already when you work in these types of settings and when you work in these environments, you may be exposed to traumatic incidents from a visual standpoint. And one thing that I try to, at least in some of the education that I've done, is the way the human mind works, the way the human memory system works. Just because you recall some of those tragic and negative things that you've seen in the past, that doesn't necessarily equate to post-traumatic stress disorder. Flashbacks could be one particular sign or symptom, but you also have the increase in arousal, avoiding situations that reminds that person of that incident. The timing could be off, the irritability, the hypervigilance that we talk about. So does PTSD exist in these settings? Absolutely. But I think a lot of times individuals in these settings may not want to address some of these unique issues. And even when there are negative visualizations that are associated with some of the on-the-job experiences, individuals may be afraid that it's possibly PTSD when it's not. And so that's kind of where some of my work has dealt with on the education and awareness, and that if a person does have or experiences some of these signs, symptoms, or issues, that's when it's time to use some of the in-house resources which I'll also touch on later. But along with these stressors that could go untreated could also lead to anxiety, alcohol abuse and substance use, suicide. So let me also discuss suicide within these populations and settings. So suicide could happen while one is currently employed in these settings and in these occupations. My experience, what I've seen over the years is that typically it also occurs when a person has left these jobs in these settings. So let's go back to that savior's mindset. Let's go back to that helping profession mindset where one's identity is so highly tied and invested in the profession. And I talked about the unique characteristics that you have to have, that you are so giving of yourself. You've made those sacrifices, and that's where your identity has been tied. So when that person gets to the end of their career, it's almost kind of like a now what? And I've also seen incidents and cases of suicide when the job is over and not while that person is involved in those high stress and high risk situations. So that's something else that we also have to be mindful of and look out for. So I'll also talk about that as far as strategies later on. And then for those who have worked particularly within the military setting and military personnel, when you have a constellation of these factors, and this is referred to as the operator syndrome, particularly those who are overseas in combat situations, where you have the accumulation of not only seeing individuals who are involved in combat being exposed to loud blasts, loud sounds and noises. You have the tactical maneuvering that's taking place that could also lead to traumatic brain injuries, TBIs, seeing others possibly being harmed, not only just oneself. So when you have the constellation accumulation of all these factors, that leads to what we know as the operator syndrome, when all these things are at work from those who serve in those combat situations overseas. All right, now let's move into some of the common work home life issues that I've seen. And I'm going to start first with law enforcement. So one of the unique things about, as well as first responders, those who are firefighters and EMTs, one of the unique things that I've seen is that these occupations, they work in the environment and setting in which they live. And that could be a pro as well as a con. So going home and having one social support system, one social support network is a positive, but also even when one is not on the job, you're still constantly surrounded by the setting and the environment in which you serve, and that could be a trigger for some individuals. Now, I've had individuals in these respective fields, particularly with law enforcement, who will tell me that one of the things that they do to kind of help them in this transition is they don't wear the uniform when they're walking in the house or walking in the door. That's kind of one way in which they try to set those boundaries as far as that work-home life balance. But that's one of the unique things that is faced in these types of populations and settings, that these various communities in which they are serving and giving of themselves, even when they are not on the clock, they are still exposed to some of those triggers and stressors. And so that's a delicate balance that one has to deal with. Now, let me move into the military and those who are working with various government agencies. And one of the common questions that I often get, and usually it's from, I'll say, it comes from all branches, but I've gotten a lot of it from Navy personnel and those who are commanders. And one of the questions I often get is, how do I help my subordinates or those who are serving below me? And I'm going to talk about some of the data that I've collected along the way, along with some of my colleagues. And the research that I started to do dealt around some of the side conversations that I would hear working in these settings. And these side conversations would often come from the different generations I've noticed over the years. And so it led me to kind of look at some of this data. And it also goes along with this question that they asked me about how do I help my subordinates. So I'm going to share some of these preliminary findings and results that my colleagues and I have put together. Give me a second here. So here's the first figure I'm going to show you. And this deals with mood differences across generations among military personnel. So higher scores reflect better mood. And what you'll see is that Gen X, which I'm also a part of this generation, reflect a better mood overall than Gen Z. And there's a generational divide, not only when it comes to military, but in many different work settings and aspects of life, we have a generational divide. And what I try to tell, because the culture setters and the leaders are in Gen X, and you have those who are kind of beginning their careers that are a part of Gen Z. And one of the things that I try to emphasize is, first, in order to get buy-in, you kind of have to understand the perspective of where individuals may be coming from with respect to their generation and some of these personality differences. So that's very important and key. But then also modeling that behavior that you want to see displayed, because a lot of the younger generations are also looking up to the older generations on how to kind of go about and fit within that particular culture. And another figure that I'll also share from some of the findings that we have is psychological hindrance. So this deals with actual functioning on the job. So the higher score indicates that these individuals are revealing that they're having a more difficult time adjusting on the job. And a lot of this comes with experience, and that is true. But once again, these younger generations are looking to the older generations on how to go about governing and moving and interacting within these environments and settings. So those of you who are in the counseling and helping profession, you are familiar with that term where we have to kind of meet individuals where they are and help them along the way, because at some point these individuals are going to be the future leaders. So across, while I'm focusing on the military, I've also looked at the other professions. So across these professions, you also kind of have to help set that foundation. And each and every generation brings with them their unique pros and cons and strengths when it comes to some of these personality differences. So I'm kind of writing up some summaries on how we can use some of these pros and cons of each generation in order to bring about a more highly and productive workforce. So that's kind of some of the things that I wanted to highlight. Let me go back to this slide now and focus on the military and some of the unique work-home life issues. So next is deployment. So within these particular occupations, many of these individuals are deployed far away from home, could be for extended periods of time, months, perhaps even years. So one of the difference when you think about law enforcement versus military who are deployed is a reintegration into one's family and home life. So if you think about earlier how I mentioned the rules, the protocol, which has to be followed, well, that reintegration can sometimes be difficult because, once again, the general society as a whole, civilian life, don't always abide by or live by those rules and protocols. One's family may not always abide by or live by those rules and protocols. Families may have their own set of rules and protocols. And so I can think of when I've worked with the Navy and how some of these commanders have revealed that when they've come back home and they try to implement some of those same rules and strategies, the spouse will say, hey, wait a minute, you're not the captain of this ship. We've been guiding and doing this thing and everything's been smoothly. You're going to have to learn how to fit in. And that can be very difficult for many individuals who have been deployed and now they're trying to reintegrate with their family as far as those differences in culture that we talked about. Something else that also stood out with me among this population, and this is for those who have been in those high risk, dangerous situations, that they have oftentimes reported to me that they are much more comfortable and much more relaxed in those high risk, dangerous situations, as opposed to dealing with day-to-day family routine and obligations, that they are much more likely to want to return back to those settings than deal with the day-to-day family life. And that's something that, unless you're kind of familiar with these populations, it could be shocking to many individuals. Now, one thing I want to highlight is the marriage part. And there are a few things that I will point out in this regard. Many individuals have spouses that have been in it for the long term, so they are well aware of these unique characteristics and traits that I've mentioned. And so the transition can be a little bit easier for those who have had spouses who have been in it for the long term and are well aware of these unique issues. But then you also have those where the spouses may not be aware of these unique issues. And that can create what I refer to as a disconnection when you have those personality traits that I've highlighted earlier, those cultural factors. And then now when this person is trying to reintegrate with the home life, the spouses may not understand the unique challenges and unique stressors. And then the individual who is serving abroad is trying to bring those cultural variables into the home, and that can create a divide. And so it's also not uncommon to see a high divorce rate among these various populations and work settings. And this can also be true for those who are first responders and law enforcement as well, but I also tend to see this more so with those who are deployed. And one other thing I'll mention on the marriage aspect, it is not uncommon to also see individuals who will marry within these professions. And the report that I get is, well, this person kind of knows what I'm going through and their understanding of what I'm going through. So that kind of also helps when it comes to that work home life balance. And then the other thing that I'll highlight, and this comes from some of the work that I've done from Figure 1 and Figure 2, and this is along with my colleagues. This is a manuscript that I'm putting together. Law enforcement, higher wellness perception and psychological functioning in military personnel. And a lot of this, I think, has to deal with the environment that I talked about earlier, where law enforcement are working in their environment, so they have that social support network that's readily available at home. Whereas you have someone who's deployed, they may not always have access to that family social support network, one spouse, kids in that regard. So I think that that plays a role. Initially, someone may point out, well, those who are in the military setting and who are deployed may be in more combat situations, but that's not necessarily true, because while I do work with a small percentage of individuals who are in these high risk, high dangerous situations, a lot of the individuals that I work with in the military are not in more of a high risk, dangerous situation than that of law enforcement. So I really do think that a lot of this deals with some of the social support network as far as family being readily available versus those who are deployed and then trying to reintegrate with one's family life. But that's something that needs to be investigated and explored more, and I will look into. All right, now let me move into some of the signs of burnout, role strain, some of the indicators that we need to be aware of. So the first one deals with the intersection of that surviving versus living mindset. So I talked about that survival mode earlier, where individuals are constantly going and going and going to the detriment of one's own well-being and self-care, attention to detail. But that can also intersect with the living mindset. So the way that I describe the living mindset is that, yeah, you're able to do your job effectively, but there's no connectedness, there's no joy, there's no fulfillment. And so this is something to be mindful of when you're doing the job, but sometimes you may not feel like you're being appreciated, or you're feeling like you're not being acknowledged for what you're doing. and that can eventually lead to burnout. So that's something to also keep in mind. Next is detachment. And so this also is related to the previous slide, where when individuals are transitioning from home, whether it's those who are working in a first responder capacity or those who are overseas and returning back to home, I've heard stories of individuals who are, as well as from family members' perspective, where they'll say that this person is physically here, but it doesn't seem like they're mentally or emotionally here. And then I've heard individuals who work in these high risk, high setting types of occupation environments that will say that they much rather be in their room. I've even heard stories of being locked up in the closet and finding peace. And that's something that we have to be mindful of and watch out for, because when individuals start to detach, that can be a potential problematic area. Next is the dark humor. And I am reminded from those who I've worked with in these settings that, hey, it's a part of the culture. And yeah, while that may be true, an over-reliance on this dark humor, while your minds and bodies are conditioned to deal with tragedy and to look at tragedy in a different light, when you start to laugh off and brush off those things and it's an over-reliance on them, those are also warning signs that we need to be mindful of. And then when you add on the irritability, easily tempered, lack of patience, that could also come along. It's another one that I was looking for that I was thinking about. Oh, sarcasm, over-reliance on that, anger, and then the substance use, primarily alcohol. These are all potential warning signs that we all need to look out for, whether it's from a family member perspective or from a colleague perspective. All right, so now I'm going to move into the strategies. And so when I talk about these strategies, I will approach this from my direct work over the years, but then also things that individuals from different types of focus groups have mentioned to me that are helpful in their work in these settings. So the first deals from my own direct experience being a clinician, and that's rolling with the resistance. I talked to you all earlier about how individuals are reluctant to want to ask for help in these types of settings. I mentioned my role doing critical stress incidents debriefings. There's still resistance and reluctance. And so that's something that I'll roll with. I'll acknowledge that. I've often been known to use jokes like, I know you're really excited to be here with me, but just acknowledging that, because I do realize that there are places and things that the individual would much rather be doing, but I'm going to acknowledge a lot of the factors that I've highlighted earlier as far as their unique stressors and just simply roll with that. Another thing that I have seen to be helpful over the years is working in group settings, and that these individuals are much more likely to open up with someone who has gone through similar circumstances. And when you think about the data that I showed you earlier with that generational divide, what I've also found is that when they see someone who's been in the field for a longer time, someone who's gone through a lot of the struggles, someone who may even be viewed as this tough person, actually be vulnerable and open up and be more open to talking about these issues and how it impacts one's personal and professional life. It's almost like that light bulb goes off and the eyes open up wide, like, wow, this person actually can show vulnerability and can show struggles, and that being vulnerable helps others also be much more likely to open up. So I think, and I know that there are many programs and organizations that have that peer support, but I think that's also still important and should be emphasized, particularly when it comes from those senior figures. Next is resiliency and post-traumatic growth. So we talked about a lot of the tragedy and things that are experienced on the job. So with trauma and setback also comes growth. And this is also related to the suicide factor that I mentioned earlier. that when one's career ends, it doesn't mean that the work necessarily needs to stop. And that's where the helping and the giving back and helping of others who are maybe facing similar circumstances that a person has already gone through and struggled with, that it's almost like, once again, we talk about connecting those generations, both are helping each other out. So that older generation is providing that resource and the years of experience. But then that younger one is there to be a sponge to take in that information. So it's almost like a reciprocal relationship where we can have the generations help each other. Then the self-care and setting boundaries. When we go back to the home and family life, those who I mentioned where the spouses have been in it for a long period of time, they're really good with helping their significant other who are in these professions set boundaries, particularly when it comes to downtime. For others, it could be a struggle. Once again, I talked about turning that light switch off and on. So that's where it involves a little bit of being selfish, that when you do have that downtime, take time for vacation, the job is still going to be there. So not bringing that work home. So that's where the social support is going to come in. And for others, we have to kind of work with them on that. Mindfulness-based strategies have also been helpful. So whether that involves meditation, breathing, journaling. So if we go back to that being detail-oriented, detail-focused, attention to detail, planned and organized, this can also be used as a source of strength when it comes to journaling and writing down throughout the week things that went well, things that went wrong, how we might want to reapproach, reformalize, but then also mentioning my positive psych background, always looking at gratitude and being thankful for the things that we have in our life and going right, whether it's family members, health, or what one has chosen to do as far as their career path. And then finally, that family and social support component that I talked briefly about. And this is related to the reintegration. And what I've seen over the years oftentimes is because individuals, when they work in these high risk, high stressful environments and the things that they've seen and been exposed to, they may sometimes dismiss or discount others, whether it's civilians, friends, and even relatives' unique stresses, because they're like, I'm dealing with life and death situations. Do you know what I've seen and been exposed to? What you're dealing with is trivial. And what I've tried to do, whether I've worked with these individuals in groups or have done family work, is emphasize that your stresses are your unique stresses, but then you also have individuals who have their unique stresses, which are impacting them. And while you may not always be able to relate to that person's unique stressors, it is affecting them. So we actually also do work on empathy. And I can tell you a lot of those senior figures that I've highlighted earlier, they're really skilled and equipped. Those who have the buy-in, rather, they're really skilled and equipped with understanding and conveying this empathy, knowing that their loved ones and family members have their own unique stresses. And the fact that they're doing what they're doing for a living might be one of their stressors. And so understanding that and being able to reflect and display this empathy helps provide cohesion within one's family. Well, I want to thank you all for allowing me to ramble on. And as I mentioned earlier, because of the time limit and the time constraints, I may not be able to address or get to every particular question that you all may have online, but this is my email. If anyone would like to ask me questions, feel free to send some comments or other areas of interest regarding what I've covered. And then I'll move to the question segment now.
Thank you, Dr. Burns. Lori, you gonna come on? And Morgan, are you still there? Just give us a second as questions are coming in.
Yes.
So we have somebody confirming they have a very tidy office.
Yeah, I saw that and I know who that came from.
So I try to keep mine a little tidy as well. Laura, you got any questions that popped in?
Looks like there is one. So somebody asked, how can people deal with the stressors they encounter in their occupation instead of letting it accumulate over time?
Yeah, that's an excellent question. And one of the things not only do I do this myself, and I've tried to impart this with those populations that I talked about. Earlier, I mentioned those mindfulness-based strategies, and I recommend that we should all take at least 10 to 20 minutes out of our day to decompress. So an example I think about is when I'm at work, and I've been known in the past to kind of take the shortcut to get to a meeting, but I don't do that now. I try to, and those of you who work at Nova know that we have a beautiful campus, and being in South Florida, you have the palm trees. I try to incorporate some of those environmental aspects. So whether it's letting the wind hit my cheek, looking at the different textures and colors of the trees. So this involves that mindfulness-based type of practice. And I guess I would emphasize it's just decompressing. So whether it's breathing, whether it's taking that walk, getting away from your desk, not eating lunch at your computer screen, engaging in those mindfulness-based practices. You can do it even at work. So it's not something you have to wait to do when you get home. Is a way to kind of just reset and recharge. Because another thing that I also tell the individuals, there are things we can and cannot control. I cannot control someone else's attitude and personality, and I call them stress carriers that may bring stress into my life, but I can choose how I react to that. And so sometimes you need to just walk away and then think about and formulate a plan on how you want to address or perhaps deal with that issue, but keeping your emotions in check is going to be very important.
Absolutely. And looks like we have another question in the chat. What is the most effective way you think clinicians can combat the dark humor in workspace?
Once again, acknowledge it, know that it is a part of the culture, but then also educate that individual on the warning signs of why that is not helpful long term. Because I do know it's used and it's going to be used. It's not going to go away. That's a part of the culture. And I think it can be, and that's where I get into that balance. It can be effective to an extent, but when a person starts to over rely on that without addressing those unique issues that I talked about, that's when it becomes problematic. Because I've seen individuals who over rely on it as opposed to let's get to the deeper issues that I went over on the slide and the PowerPoints. I think that's when it becomes problematic and should be brought to attention. But otherwise, there are going to be people who do it, and yeah, that's fine. But that's when it's an over reliance. I think it's problematic.
Okay. Seems like we have a longer one. Have you ever worked with any fire/EMT departments that incorporate this psychoeducation into their onboarding or regular day of work?
I'm sorry. Go ahead. Sorry. Go ahead.
You can answer the first part, and then I'll ask you the second part.
All right. So this is just my own personal experience over the years. And I'm not trying to knock any other profession because I've worked across many of them. But I have found firefighters and EMTs to be the most receptive. So that's what I'll add. When it comes to a lot of the stuff that I'm discussing, much more receptive and open to incorporating these. Not to say that I don't have law enforcement or military. I do, but I'll say just overall, just based on my own personal experiences, the most receptive when it comes to incorporating these types of strategies.
And do you think departments are getting more open to this kind of care?
I'm sorry, I didn't hear you.
Do you think departments are getting more open to this kind of care?
Yeah, and that has to do with that generational divide thing that I've shown you. So, if you look at my generation who are also trained and raised by baby boomers, that's where that old guard comes in. This is not to say that there isn't buy-in from my generation, but as you start to see millennials and Gen Z, it's becoming a little bit more open and more receptive, but we still have a ways to go.
And what do you think are some early signs that a professional is moving from resilience into a burnout?
Early signs from resiliency to burnout. So I've highlighted a few of them. So when a person starts to feel like they're not connected to the job, where it just becomes a job and not a passion. So realistically, do we all fall into that mindset? Yes. And I kind of call this thriving. But when a person starts to see the job as just a job, just something to do, that I'm doing it for the check and not the fulfillment and the commitment and the services that I'm bringing to someone, that's a potential warning sign. Also, the disconnection from the job, not being highly in tuned, emotionally invested. That's another warning sign. And then along with some of the stressors and the anxiety, that's another warning sign. And typically when you see a person's mood change when they're outside the work environment, meaning that when they're at home, you may not necessarily see those same signs and symptoms, but when they return to work, it's almost like, all right, here we go again. Then you know that that's kind of a clear indication of burnout and that the person needs to recharge. So whether that's on a personal level, and I forgot to mention this, in-house resources, which people are reluctant to use. And I know because some individuals fear that they may be reprimanded or this information may affect their ability to perform on the job. But then there are also outside resources that are available as well. So that's what I encourage individuals when they do start to experience some of those signs to utilize.
Somebody asked, how applicable is this type of care for medical and psychological providers, particularly high intensity crisis providers, and any tips for individuals that do not wear a uniform?
So are you referring to those who work in the professions of medical and being psychological providers and engaging in these strategies as well? Is that? Yes, I think it's very applicable. And it goes back to that mindset, because over the years when I've worked with these groups, I'm like, I also experienced this, and those in my profession also experienced this, where you are helping others, you are so giving of others. And I think about even when I'm helping these particular groups and these particular individuals, that sometimes I have to find the correct balance too, because I start to neglect my own well-being and my own care and my home life. So I think it's very applicable, and it all goes back to that helping mindset. Absolutely. Sometimes they are a reminder for myself. I'm like, all right, I got to practice what I preach too as well. So absolutely.
And it looks like we got one more. Are autistic individuals who work in these fields averse to therapy, or is it trying to find the right psychologist?
So I don't have as much experience when you say autistic individuals in that regard. So I could not fully answer that. So sorry about that.
I think that was our last question.
Well, thank you, Dr. Burns. Thank you, Laurie. Some guests have asked for slides. What we do is provide the recording within 24 hours. Unfortunately, I don't have a function to provide the slides for you. Thank you very much. And thank you for joining us. Thank you again, Dr. Burns. Any final thoughts? We're getting some nice compliments from folks that we know.
Thank you. Thank you all.
Great. Well, have a great day, and we'll keep in touch and see you in the halls.
Bye-bye.